my name is Anna. I'm a podiatrist working at Western Health.
And hi, my name is Simone and I'm also a podiatrist working at Western Health.
Today we're just going to talk to you about how you can look after your feet. So we're going to teach you how to check your own feet. We're also going to teach you how you could ask a loved one or a family member to check your feet. And we're going to teach you about the right or appropriate footwear to wear when you're at home and when you're out walking or exercising. So I'm just going to show you how to check a loved one's feet. Today I'm wearing gloves, but at home you can just practice good hand hygiene, washing your hands before and after you check a loved one's foot. So the first thing we're going to do is look at the skin integrity. So we're looking to make sure that there are no reddened areas, cuts, cracks or blisters, or any discoloration to the skin. So we look at all of the foot and particularly taking note of the heel. This is especially important if your loved one spends a lot of time in bed. The other thing that we always make sure we do is check between every single toe. When you're helping your loved one shower or wash, always make sure that you help them dry carefully between their toes. If you do find anything on your feet, such as a cut, a crack, a reddened area, discoloration or blisters, clean with clean water and apply clean dressings. Then as soon as possible, go and see your family doctor or GP or your podiatrist.
So now I'm going to show you how to check your feet if you don't have access to a family member to do this for you. So if you can get yourself a mirror that's quite large, and sitting, most people find it easier sitting on a chair, and they can bring their leg up a little bit and use the mirror to angle around and have a look at the foot, again paying particular attention to around the heels, the bottom of the foot, and if you can, in between the toes. Okay. If it's hard to get your leg up, you may wish to pop the mirror on the floor and have a look at it that way over the top. If you do find any cuts, scratches, blisters or any reddened areas on your feet, as mentioned previously, do seek the help of a health professional, either your GP or your own podiatrist.
Now I'm just going to talk to you about what to look for in a good shoe. So it's always really important that you are fitted appropriately for a shoe by a professional. When we look at a shoe, we want to make sure that the shoe is wide enough and deep enough for you at the toe box. We also need to make sure that the shoe has a non-slip sole, a firm back, and a fastening device so it doesn't slip off your foot. So this is a sneaker, and this is a really good example of a shoe that you could wear every day. If you have trouble doing up laces, a Velcro is another option. If you have trouble putting shoes on, Velcro is also a good option because it allows you to slip your foot into the shoe. If you're not leaving the house, it's still a good idea to put socks and shoes on every day. If you wear slippers, you still need to have a slipper with a non-slip sole and a fastening device that is wide enough at the toes and deep enough so as not to cause any pressure areas on your feet.
I hope you found these tips helpful in maintaining your foot health. And remember that if you have a chronic condition such as diabetes or rheumatoid arthritis, please keep seeing your podiatrist and health professionals to maintain your foot health.